Okay, so my hip eval was on a football player at Grinnell. Chief complaint was left proximal hip pain over like the ASIS region. History of that injury started a few weeks ago. It's progressively gotten worse. 2 weeks before that, he sprained his right ankle. And we're kind of thinking that was probably his MOI. So sprained his ankle, gait changed, put extra pressure on that left hip, and then that caused this injury. Progressively got worse after he first noticed it. First noticed it was at practice, like right after practice. Wakes up the next morning and it's just super sore. So thinking it was more of a general overuse injury, and it's just progressively gotten worse since then. Walking isn't too painful. At some points he was limping, but the day of the eval he wasn't limping. Going up and down stairs is moderately okay. Sometimes he has issues with going downstairs, but for the most part it's fine. Running he can't do. As soon as he starts to run, it lights up pretty bad, and it's mostly the swing phase, so that push off and then coming back up to get his knee drive in is where he hurts him the most. As soon as he does that, it just hurts, and then if he continues to run on it, it just gets worse and worse and worse, and doesn't really feel a whole lot better. So past medical history, he sprained his left hip in middle school, so that would have been like 6 or 7 years before. So nothing really there. Medications none, allergies none. Onto the actual exam. So palpations, rectus femoris, ASIS, AIIS, VMO, vastus media, vastus lateralis, hamstrings, pretty much all of them were normal. No pain, no issues there with palpations. The only two that kind of got him were AIS and then proximal rectus femoris. So that AIS was painful, definitely had some tightness running through there. And then on the rectus femoris, once getting more proximal, the pain got worse and worse, and like his worst pain was probably the worst pain he had was probably right under the AIS. So kind of in that like proximal quad tendon region. Range of motion, hip flexion, internal rotation, and hip extension were all limited. All were very painful. Flexion and internal rotation were probably the most painful. Manual muscle testing, I only did the quads and then rectus femoris. So general quad extension for the quads, just a little painful for him. Nothing super crazy there. Strength was fairly normal bilaterally. The rectus was, he could move it against gravity up to a point. He couldn't get it all the way up, so that's why the range of motion was really limited. But as soon as pressure was applied for the MMT, he couldn't lift it off the table. So graded that as a 3. For my tests, I did Thomas, Eli, Faber, and Fadir. All of those came out as positive, which I wasn't too surprised that Faber and Fadir were positive, mainly just because it kind of brings them up into that flexion and just pretty much impinging on that AIIS. So from what I was seeing, I wasn't suspecting any like labrum or anything like that. Also did Thomas and Eli, which were showing pretty tight like iliopsoas, hip flexors, rectus femoris. And then so for like actual like diagnoses, I said I got quad tendon, some form of strain or tendinopathy, just overuse injury, probably from that gait change. So how I felt about the eval, I felt good about it. I consulted with my preceptor after, and he kind of had the same idea for like diagnoses and stuff. So I felt good about how I got to my diagnosis, like in general. But overall, I definitely think I could have done Need to actually measure my range of motion instead of just eyeballing it, because I didn't use a Goni. So definitely need to get on that. It's just easy for me to forget to go grab it because it's across the clinic and I don't really think about it. And then manual muscle testing. Probably could have done a couple more. So I did the rectus and then the 3 other quads. Probably should have done, the another hip flexor one, maybe the hamstrings, but I didn't do the hamstrings mainly because he had no pain back there, and so didn't really think about it. But for my palpations, I pretty much hit everything in the anterior hip and thigh. It's didn't really go to lumbar sacral at all, just because he had no pain back there, and so wouldn't have gotten anything out of it. As for special tests, I think I did the ones I needed to do. I don't think I needed to do any more. Honestly, I don't think I really needed to do Fadir at all. Or not Fadir, Faber. I don't really think I needed to do Faber. I think I just did it in my cluster just to get an extra view on it. Really, I just needed Thomas, Eli's, and Fadir's, I think. And then for history, all that, I think I got a pretty concise history of this. Thing I didn't mention is the patient's also concussed at the moment, so that's definitely another thing to keep on track of with him, along with this hip, but that's a whole different thing. So yeah, that's what I got.